Today, let's talk about a common disease that healthcare providers encounter: diarrhea. So, what exactly is diarrhea? Diarrhea is loose watery stools. You have diarrhea if you have loose stools 3 or more times in one day. Most common type of diarrhea is acute diarrhea. It usually lasts about a day or two, but sometimes it may last longer. Some of the most common causes of diarrhea are poor sanitation, ingesting contaminated food or water, food intolerances, microorganisms, and some medication. Patients with diarrhea often complain having fever, stomach pain, vomiting, feeling dizzy, bloating, and abdominal cramps. Severity of these symptoms can vary, but if untreated can lead to death due to dehydration. There is a sufficient number of deaths caused by diarrhea all over the world. Moreover, the number of deaths in Pakistan are also quite alarming. So what actually happens in diarrhea? When your digestive system is normal, food and fluid pass regularly from the stomach into the small intestine. Food is then broken down and nutrients are absorbed along with the most of the fluid. The remaining waste and some water pass into the colon where more water is absorbed. Finally, the waste is passed in the form of stools. When the cells in your small intestine or colon are irritated, the relaxed and regular movement of your intestine can become overactive, and essential fluids and salt end up being passed through the colon too quickly, with less fluid being absorbed by the body. The result is loose or watery stools. That is diarrhea. Here is where Imodium comes in to assist the healthcare providers. Imodium capsules contain an active ingredient called loperamide, which works to slow your system to its normal pace. This allows the body to start absorbing fluids and salt as it should, restoring the consistency of stools. Imodium effectively treats acute, chronic, and traveler's diarrhea, increases GI transit time, absorption of water, and electrolytes. Imodium decreases the GI motility, GI secretions, decreasing the frequency and urgency of bowel movements. Loperamide does not cross the blood-brain barrier, hence is free from abuse potential. Imodium is effective and safe because of its high therapeutic index. Imodium is the innovator brand that is trusted choice of healthcare providers for decades in Pakistan. Dosage. The Imodium dosage for acute and chronic diarrhea for children from the age of 6 to 17 is 1 capsule to start with, followed by 1 capsule after every subsequent loose stool. For chronic diarrhea, the initial dose should be adjusted until 1 or 2 solid stools a day are obtained. The maximum dose of Imodium for children is 3 capsules per day. For adults, the initial dose is 2 capsules to start with, followed by 1 capsule after every subsequent loose stool. For chronic diarrhea, the initial dose should be adjusted until 1 or 2 solid stools a day are obtained. The maximum dose of Imodium for adults is 8 capsules per day. Imodium should not be used in patients having high fever, blood in stools, ulcerative colitis, and children under 6 years of age.